I'm Doug Moore. I'm a precinct committeeman in Sycamore, and I thought Mr. Huffman did an excellent job. He spent a lot of time answering everybody's questions, and I particularly was impressed by his courage on his stand regarding the situation in Afghanistan.
I was impressed. Very smooth. I'm slightly aware of his civil servant career and impressed with that, enough to bring us to the room. And his answers on my 2 litmus test questions were accurate as far as I'm concerned. So actually I just asked my husband Joe here if he wanted to leave a check tonight and save a stamp, or if he wanted me to do it online so we get the bonus points for our air miles. So we're a believer and we know what it takes to make it happen. So way to go, David. You got our votes. That's 2. 2 out in Waterman.
2 in building.
2 out in Waterman.
And we need a public option. We need the change that says that health insurance companies cannot cut off people based on a pre-existing condition. And another thing we need that I don't think we've seen enough of from Washington is we need mandates that provide for preventive care on all insurance plans. We should be able to imagine a world where checkups, vaccines, and pre-cancer screenings are covered and standard on all insurance policies. Look, when you go to buy, thank you, when you go to buy car insurance, there are laws that say car insurance companies have to have certain parts that are covered. It's mandatory. We need to do the same thing with health insurance plans. And I guarantee you, health insurance companies will figure out a way to make money based on those mandates. But we as the government need to stop relying on the health insurance companies to protect the public interest. That's what our government is about. We need to be there to protect the public interest. Too much of this has been contracted out to the health insurance companies, who ultimately are responsible for making the decisions for us about what's covered and what's not, and what kind of recourse do we have. How many people in this room have experienced this personally or with friends or family, where we go to the doctor, something needs to happen, we get a big bill, and we don't know whether the insurance company is going to cover it. And sometimes they do, and sometimes they don't. There needs to be, for the things that matter most for our health, there need to be clear standards and clear mandatory requirements, and that includes preventive care. It would make us healthier, and it would lower costs of the back end. Now, why haven't insurance companies done that automatically? Why doesn't the market just do that? Why doesn't the market take care of itself? Well, for insurance companies, they say it's too expensive. It's too expensive to cover all the people in the country with preventive care. What they would rather do is not cover the preventive care as a mandatory feature, but instead, that means that some people, not everybody, but some people will get sick, will get disease that wasn't caught early, and then they'll pay for that care to cover the sickness or the disease at the back end. They think they'll make more money that way. Well, you know, what that reminds me of, and I've been accused of going a little too far on this, but I'm going to keep saying it. You know, one of the things that reminds me of is, remember the Ford Pinto situation? Remember the Ford Pinto situation in the 70s, when it came out that Ford had actually discovered this design defect. And instead of making the choice to fix it, they made the cynical judgment that it was cheaper for them to not fix it and just to pay the judgments later from the lawsuits. And that later came out. And I believe that this decision that health insurance companies have made to not cover preventive care across the board is in the same ballpark. We need, as a government, to be more aggressive about standing up for the public interest and insisting that preventive care be covered across the board, and then let the market work and let them figure out the right way for them to make their profits based on that. And I guarantee you, they'll figure out a way. One last thing about health care. One of the core elements of what we have in America is innovation and entrepreneurship. I believe that we will remain for many, 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 many decades to come, when my son grows old and is looking at his grandchildren, a great country in part because we have always prioritized entrepreneurship and innovation. But our failure to reform our healthcare system is a big drag on that. So many people decide not to go out for business on their own, decide not to leave a large employer and go with a small business because they believe they're not going to be able to bring their healthcare there, they're not going to have healthcare there, or healthcare simply won't be affordable. And they're right. They're absolutely right. And that failure means that we have less innovation,